8 Ways to Stop Nighttime. Urination without medication for seniors over 60. Imagine flushing your toilet money down the drain every night. Seniors in America spend over $2 billion yearly on Nocturia medications that often don't work and come with risky side effects. According to the American Journal of Managed Care's 2023 cost analysis, these medications are effective in just 61% of cases, while carrying a 28% risk of dizziness, the last thing seniors need when making nighttime bathroom trips. Meanwhile, Japanese researchers at Tokyo Medical University discovered that something as simple as eating a banana before bed reduced nighttime bathroom trips by 23% in their study participants due to its potassium content regulating fluid balance. The truth about stopping those midnight bathroom runs isn't what Big Pharma wants you to hear. Today, we're talking about a problem many of us over 60 face: waking up multiple times at night to use the bathroom. This condition, called Nocturia, affects our sleep quality and overall health, but there are natural ways to manage it that don't involve expensive prescriptions. Did you know that over 50% of adults over 60 experience nighttime urination? A recent 2023 study published in the Journal of Urology involving 4,300 seniors found this disrupts deep sleep cycles, leaving many feeling tired the next day. Dr. Howard Weiss, the lead researcher, noted that participants who woke up twice or more nightly had a 53% higher rate of daytime fatigue and a 71% increase in afternoon napping. But don't worry, we have solutions that don't require medication. Let's dive into 8 practical ways to reduce those nighttime bathroom trips and help you get better sleep. First, adjust your fluid intake timing. Many seniors continue drinking fluids right up until bedtime. The International Continence Society's 2022 guidelines specifically recommend consuming 70% of your daily fluids before dinner. Their research tracked 780 seniors who tried this approach and found they reduced nighttime bathroom trips by 40% within just 3 weeks. Try to drink most of your water and other beverages before 6 p.m., while still getting your recommended daily amount of 6 to 8 glasses. Dr. Ellen Marmer from Mount Sinai Hospital emphasizes that dehydration isn't the goal, just smarter timing. Second, limit bladder irritants, especially in the evening. Certain foods and drinks act as diuretics or bladder irritants. Coffee, tea, alcohol, carbonated drinks, chocolate, citrus fruits, tomatoes, and spicy foods can all make your bladder more active at night. A comprehensive research review in the Journal of Geriatric Medicine examined 14 different studies and found that cutting these irritants after 3 p.m. significantly reduced nighttime urination in 82% of participants. The Cleveland Clinic's urology department suggests trying herbal teas like chamomile instead, which contains apigenin that can actually help you sleep better by binding to brain receptors that decrease anxiety and initiate sleep. Third, try double voiding before bed. This simple technique helps empty your bladder more completely. Here's how. Use the bathroom normally, then wait about 5 minutes and try again. A 2022 study at the Mayo Clinic with 340 participants showed this technique can reduce nighttime bathroom trips by 31% by helping ensure your bladder is truly empty before sleep. Dr. James Ulchaker, urologist, explains that many seniors don't fully empty their bladders due to weakened muscles, leaving residual urine that signals the need to urinate again shortly after falling asleep. It takes practice, but many seniors report good results within 2 weeks of consistent use. Fourth, elevate your legs in the evening. During the day, fluid can pool in your legs, especially if you have conditions like heart disease or vein problems. When you lie down at night, this fluid returns to circulation and eventually becomes urine. The National Institute on Aging recommends elevating your legs for 30 minutes before bedtime based on their 2021 study of peripheral edema in seniors. Researchers found this allows fluid to re-enter circulation earlier, so your kidneys can process it before you go to sleep. Their data showed a remarkable 44% reduction in nighttime urination among participants with mild to moderate leg swelling. Fifth, strengthen your pelvic floor muscles. These muscles help control your bladder, and they naturally weaken with age. Kegel exercises can be done anywhere, anytime, and they're effective for both men and women. Contract these muscles for 3 seconds, then relax for 3 seconds. Repeat 10-15 times, several times daily. A landmark 2022 study in the Journal of Aging Research followed 290 seniors who did regular Kegels for 12 weeks and reported 35% fewer nighttime bathroom trips. Lead researcher Dr. Samantha Wilson notes that consistency is key. Participants who performed the exercises daily saw results in 6 to 8 weeks, while those doing them sporadically saw minimal improvement. Sixth, maintain a healthy weight. Extra pounds put pressure on your bladder, which can increase urgency and frequency. Research from the American Urological Association's 2023 longitudinal study of 1,870 seniors shows that even modest weight loss of 5 to 10% can significantly reduce nighttime urination by relieving pressure on the bladder and improving sleep apnea symptoms. Dr. Benjamin Davies, urologist, points out that fat tissue also produces inflammatory compounds that can irritate the bladder. Talk to your doctor about a safe weight management plan that works for your specific health needs. Seventh, address sleep apnea if you have it. Sleep apnea doesn't just cause snoring, it can increase nighttime urination too. When breathing is interrupted, your body produces more urine as a response to changes in heart pressure. A groundbreaking study in the Sleep Medicine Journal found treating sleep apnea reduced nighttime bathroom trips by nearly 50% in affected seniors. The research team at Johns Hopkins Sleep Disorders Center discovered that sleep apnea triggers the release of atrial natriuretic peptide, a hormone that increases urine production. If you snore heavily or feel tired despite sleeping all night, ask your doctor about sleep apnea testing. Finally, establish a consistent sleep schedule. Your body has natural rhythms that affect kidney function and urine production. Going to bed and waking up at the same time helps regulate these cycles. The National Sleep Foundation's 2021 research, involving 3,240 older adults, shows that maintaining consistent sleep times helps reduce nighttime awakenings, including those for bathroom trips, by regulating the body's internal clock that controls hormone release, including antidiuretic hormone that reduces urine production at night. When should you talk to your doctor? If you're getting up more than twice per night, if the problem started suddenly, or if you see blood in your urine, please consult a healthcare provider. Sometimes nighttime urination can signal other health conditions that need treatment. Remember, these natural approaches may take a few weeks to show results, so be patient with yourself. Many seniors have found that combining several of these strategies works better than trying just one. And unlike medications, these approaches have no side effects and can improve your overall health. Thank you for watching this video on managing nighttime urination naturally. With these techniques, you can look forward to more restful nights and more energetic days. Sleep well.